probably the easiest way to explain managed care is it's a shave away from being single payer. It's about as close to single payer as you can get. So instead of it being run by the government, now all of these health decisions, everything that you do is decided by what are called MCO, managed care authorities, right? And these managed care authorities are insurance companies. They're not doctors, they're not physicians, they're not people like that. And so what happens is when you go to when the doctor renders a service to you, they have to now put in a claim instead of doing it with the healthcare authority, which used to pay out low. Even the doctors have said we were top 4 in the nation for the lowest payout per capita. But the doctors were okay with that because they were consistent. They paid out every time. They could run their business that way, and they weren't fine with it. So the taxpayers were getting more bang for their buck. They were getting more people taken care of at a cheaper cost on the system that we had. Then we shifted to managed care. And when you study other states, exactly what's happening now in this state has happened in other states. This is not a surprise. So now, instead of going through the healthcare authority, they have to go through an insurance company, and that insurance company says, we're going to pay for that healthcare thing you've already rendered, or we're not. And what happens is when you balk enough time on these doctors, kind of what Salome was talking about, eventually these doctors say, I'm better off to go off of SoonerCare and just take cash pay payments or people who have private insurance. And that cuts out the entire sector of people we're trying to help with those taxpayer dollars, because now your doctors get so frustrated with it that they're done.
And a lot of these people who are on this system are like Salome, adoptive.
You have a lot of people that go through the adoption services in Oklahoma that are automatically put on it and placed on it. And that's an effort to help our adoption services grow in Oklahoma, and that's a fight against abortion. Because if we have a healthy adoption service, then why is there a single need for an abortion in the state of Oklahoma? But that's collapsing. Those people who need it the most under our adoption services are not getting those services.
Also, the foster care program. A lot of the people on the SoonerCare are also on the foster care program, and these are children that are not adopted. They're just in the system. They're DHS custody. They're state custody.